why does it seem like rheumatoid arthritis mostly picks on women? If you have noticed that in your own life, you are not imagining it. Women are actually 2 to 3 times more likely to develop rheumatoid arthritis compared to men. That's a huge difference. But here is the hopeful part. When we understand why, we can take better steps to protect ourselves, manage symptoms, and live a fuller life despite the diagnosis of rheumatoid arthritis. So today, I am bringing it all down. Hormones, genes, lifestyle, and stress, and giving you 3 simple action steps you can start today to feel stronger and more control of your life. Make sure to like, subscribe, and share, because together we can stay stronger and more area could benefit from all the content we are producing. Now, for those who are new here, I am Dr. Ananta Subedi, a board-certified rheumatologist, co-founder of our practice, the Empower Arthritis and Rheumatology Center in Cary, North Carolina, and the voice behind the Rheum Doc. I've spent over a decade working with patients who live with rheumatoid arthritis and autoimmune conditions. I have seen the struggles and also the amazing resilience and victories. So today, let me answer the big question. Why do women get rheumatoid arthritis more often than men, and what can we do about it? Now, here's a spoiler alert. It's not just one reason. It's a mix of hormone, genetics, environment, and lifestyle. But here's the good news. You can take steps to tip the balance in your favor so that you don't get affected by rheumatoid arthritis and you can manage it better. Before we dive into why women are more affected, let's quickly go over what RA actually is. As many of you are already aware, RA is not just simple arthritis. It's an autoimmune disease. That means your immune system, which is supposed to protect you, start attacking your own joints. You can imagine your immune system is like a guard dog. Normally, it barks at intruders like bacteria, the viruses. But in RA, the dog gets confused and start barking at its own family members, and that is your joints. That's why you feel pain, swelling, stiffness, and fatigue. And unlike the common form of arthritis we call osteoarthritis, which is more about wear and tear, RA can affect your whole body, your heart, your lungs, your eyes, and even your energy level, causing significant fatigue. Now, here is the striking fact. About 75% of rheumatoid arthritis patients are women. That means if you gather 4 RAers in a room, chances are 3 will be women. This is not random. It's biology and environmental working together against you. Now, let's start with the first and most important factor, that is hormones and rheumatoid arthritis. Hormones are the tiny messengers that control everything from mood to our growth. Women have higher level of estrogen, which can make the immune system more active. Normally, that's great for fighting infections. But in rheumatoid arthritis, it means the immune system is more likely to go into an attack mode by mistake. That's why many autoimmune diseases such as rheumatoid arthritis, lupus, multiple sclerosis are much more common in women. And here is something fascinating. Many women notice that rheumatoid arthritis symptoms change during pregnancy or during menopause. During pregnancy, when hormone levels shifts, some women actually feel better. After delivery or at menopause, symptoms may flare up again. So hormones are not the only factor, but they are a big player in this disease. Now, the second factor is genes and the family history. So genes are your body's instruction manual. If your mother, grandmother, or sister has rheumatoid arthritis, your risk for rheumatoid arthritis goes up. But here's a twist. Even if men and women share the same genes, women still get RA more often. That tells us hormones and lifestyle factor magnify the genetic risk. Now, let me use an example. So you can think of the genes like a loaded gun, but the environmental is what pulls the trigger. Hence, you have a combination of a genetic risk factor along with the environmental trigger to cause rheumatoid arthritis. Now, let's talk about the role of environment and lifestyle that affect your risk of rheumatoid arthritis. Now, you might think of what kind of triggers? Things like smoking, air pollution, chronic stress, and even certain infections. For women, especially stress is a major factor. Now, many of you women who are watching this video, you might think of you have work, you are taking care of your family responsibilities, and you have to take care of all of them all. And you are under a lot of constant stress. And science shows stress hormones can fuel inflammation and flares. So no wonder why women have more risk of having autoimmune diseases, including rheumatoid arthritis. Now, this is exactly where our NEST framework, the nutrition, exercise, sleep, and stress management comes handy. These are the 4 pillars and things that you can control, and they make a real difference in how RA shapes you. And managing those 4 pillars, you can help control your rheumatoid arthritis symptoms as well as even reduce your risk of having rheumatoid arthritis. Now, let me quickly share a story of one of my patients. A patient of mine who is 30-year-old, and she's a floral designer, always on her feet. She smoked, lived under a lot of stress, and felt like rheumatoid arthritis had stolen her spark. When she came to me, we worked together, we make some treatment plan, and I helped her quit smoking, started her to do regular exercise 10 minutes a day, and made some small changes in her diet, including adding some anti-inflammatory diet, minimizing her pro-inflammatory diet. Within 3 months later, she came to me smiling. She mentioned she has less stiffness, more energy, and more hope. And she told me, Dr. Subedi, I did not realize how much power I had in my own healing process. That's the message I want you to hear too. RA does not mean powerless. You have more influence on your health than you think. So what does that all mean? It means that if you are a woman, you are at higher risk, but you have also a chance to catch it early and take action to minimize your risk of rheumatoid arthritis. And this is how we can catch it early. Look out for these early symptoms of rheumatoid arthritis. Morning stiffness that lasts for more than 30 minutes, swelling or redness in your joints like fingers and the wrist, extreme unexplained fatigue. These early RA symptoms help us diagnose this disease early, and we can make some treatment changes that can help you feel better and prevent your long-term joint damage due to rheumatoid arthritis. Now, let's wrap up all together. Women get RA more often because of hormones, genes, lifestyle triggers, and many more. But through our NEST framework, working on nutrition, exercise, sleep, and stress management, and also following our 4F framework, faith, family, friends, and fulfillment, you can take control of your life. And you can also decrease your risk of rheumatoid arthritis. And remember, RA is part of your story, but it does not define your whole life. And let me give you 3 simple steps that you can take today to take control of your life. Number 1, eat 1 anti-inflammatory food a day. That could be a fish like salmon, walnuts, or blueberries. Number 2, move gently for at least 5 minutes a day. A walk around the block or light stretching counts for your rheumatoid arthritis treatment. And number 3, call one loved one. Build connection and lower your stress through our 4F framework that includes faith, family, friends, and fulfillment at your work. These are small steps but can make a big difference on how you manage your health. And finally, all of our RAers, thank you for joining me today. If this video helped you, please like, subscribe, and share with a fellow warrior who could benefit from this information and can live a fulfilling life despite the diagnosis of rheumatoid arthritis. And remember, you are not alone. Together with our community at the Room Doc, we can move from pain to possibilities. And at the end, stay strong, stay hopeful, and I'll see you all in the next video. Bye-bye.